Casha. I'm a cardiothoracic surgeon and I'm one of the inventors of the rib bridge. And I'd like to tell you about some of the advantages we see in the rib bridge. Now, when people have lung cancer that invades the chest wall, we usually would resect part of the chest wall and would replace this with a bone cement sandwich. This is a CD. Imagine that this was fixed onto your chest wall, somewhere here or here, wherever. And of course, this would decrease your mobility and also your ability to breathe. Now, our replacement is this titanium device that can be twisted to form an artificial rib. As you can see in the skeleton over here, the two struts gives the ability of the device to fit the contour of the chest wall, and also the torsion is present such that it can follow ribs even though they may change direction. Okay, this means that the device is easy to apply in the individual case, and by having three sizes we can more or less fit almost all the defects. And you can imagine that once these are in place, the surgeon then applies a soft mesh as used in a hernia repair to give a degree of stability to the chest wall. In other words, when the patient breathes in, this does not collapse inside, so that the patient can breathe comfortably and yet maintain the patient's ability chest to move up and down, increasing his breathing capacity. And at the same time, there's also the range of movement, which would be limited if you had to have something stuck onto your chest wall, so you'd still be able to move around. So normal mobility would be maintained. This is very important for a patient who has otherwise to come to terms with a rigid chest wall. The device is easy to apply, and as you can see over here, it takes a curvature and then it's held in by two screws. We think that this device should improve, revolutionize the management of these chest wall defects, so that the improved physiology should mean that patients who were otherwise borderline for this type of surgery would now be suitable for the surgery. And to boot, they would feel better off afterwards.